Hello, this is a talk on increased incidence of type 2 diabetes mellitus. My name is Andrew Kraft. I'm a graduate of SGU School of Medicine. I'm an MPH student, and this is a community medicine seminar. Introduction. Diabetes mellitus incidence has been increasing for many years due to poor nutrition and lack of physical activity. Type 2 diabetes in teenagers is now occurring, which previously did not occur. Nutrition in the United States has changed dramatically in the past 30 years. More fast food restaurants in downtown areas and healthy food options are in a lot of cities now. And the size of sodas at a fast food restaurant have at least tripled in the past 20 years. More introduction. Physical activity has decreased over the past 15-20 years due to the change of work environment. Most individuals work in a sedentary office environment for most of their working adult lives. Young children are now playing video games and computers for hours at a time, compared to years ago where individuals would be outside playing sports with their friends. More introduction. This change with poor nutrition in combination with lack of physical activity has led to overweight and obesity rates to increase all over the world and also increases the incidence of type 2 diabetes mellitus. Epidemiology of diabetes mellitus. The prevalence of diabetes mellitus in the United States for 2012 was 29 million people. The population of the United States is roughly 320 million people. The incidence of diabetes mellitus in the United States for 2012 was 1.4 million people. If the prevalence continues at this rate, 1/3 of the United States population will have diabetes mellitus in 2050. With population numbers right now, that would be roughly 100 million people in the US with diabetes mellitus, and population growth will typically increase. So it would probably be more than 100 million people with diabetes mellitus in 2050. There are two types of diabetes mellitus. Type 1 diabetes mellitus is in young children who never had the ability to make insulin due to damage to the beta cells in their pancreas. And there's also type 2 diabetes mellitus, which is in adults that have insulin resistance. This type of diabetes mellitus is now occurring at younger ages, like early teenage years, due to poor nutrition. And type 2 diabetes is where the incidence has increased in the population in the past couple of years. Type 2 diabetes is where the problem is at with this talk. Diabetes mellitus symptoms: polyuria, which is urinating frequently, polydipsia, which is drinking a lot of water, and polyphagia, which is eating a lot of food. Other symptoms include weight loss, vision changes, numbness, and tingling in lower extremities. Some patients will not have any symptoms at all. Diabetes mellitus workup. If they have an A1C, which is tracking the glucose attached to their red blood cells, is greater than 6.5, then that is diagnostic for diabetes mellitus. A fasting glucose of greater than 126 is diagnostic. Random glucose greater than 200 is diagnostic, and a glucose tolerance test can also be used. Diabetes mellitus screening. Patients can start being screened at 45 years old or earlier if they have a family history of diabetes mellitus or other risk factors. Other risk factors include being overweight, being obese, having hypertension, and having high cholesterol. The screening test that can be done for these patients would be an A1C and fasting glucose, as talked about before. The treatment for type 1 diabetes mellitus, insulin is the mainstay for type 1 diabetes. Patients need insulin at each meal, and devices are available to these patients to inject insulin at a regulated dose and also check the glucose levels. There are short-acting insulin called Lispro and also long-acting insulins called clarginine, and they can be used for these patients. Generally, the patient will get a dose of clarginine, which is the long-acting, in the morning or in the evening, and then with meals, the patient will take the short-acting Lispro. So they'll take Lispro probably 3 times a day when they eat, and it'll be correlated to their meals, and they'll be checking their glucose after they eat. Treatment for the type 2 diabetes mellitus, metformin is the most common medication for type 2 diabetes mellitus. Other medications include the GLP-1 exenatide, DPP-4 inhibitor, sitagliptin, and insulin can be used in type 2 diabetes mellitus if the case is severe and the other medications are not working. Counseling for diabetes mellitus, important to educate patients on benefits of weight loss by nutrition changes and exercise, and also patients have decreased their A1C without losing that much weight, but still having moderate exercise due to decreasing their insulin resistance and increasing their insulin sensitivity. Monitoring diabetes mellitus, for hemoglobin A1C, around 7 is the target for most patients while having diabetes mellitus. Random glucose checks can occur as well, and the patient will need eye exams once a year and also foot exam once a year. And the patient will have their kidney function monitored via creatinine, BUN, and urine protein. And generally, the diabetes mellitus patients come to the primary care provider at least every 3 months. Complications of diabetes mellitus, complications of poor nutrition leading to this would be retinopathy, which would be damage to their eyes, nephropathy, which would be damage to their kidneys, peripheral neuropathy, which would be damage to their lower extremities, and cardiovascular disease. Many patients with nephropathy will get chronic kidney disease in the future, leading to needing dialysis. Major complications include diabetic ketoacidosis for type 1 diabetics. Characteristics. The individual characteristics, diabetes mellitus is worsening due to nutrition habits that have changed and individuals working out less than previous generations. Population characteristics, governmental regulation is not occurring due to lowering calories or per meal at a restaurant. They're letting the restaurants do whatever they want, and you can go into a restaurant and get a meal of 3,000 calories. The at-risk populations, individuals that are lower income status, can't afford expensive nutritious foods, so they go to a fast food restaurant many times a week instead of healthy food options. Also, there are food deserts where patients can't even get to a grocery store and they can only eat fast food due to not having a grocery store within a 10-mile radius. And this leads to many diseases, including diabetes mellitus. Prevention, government regulation on how many calories can be offered per meal by a restaurant is important, and I think around 750 calories for a meal at a fast food restaurant would be pretty fair, maybe a little less than that, maybe 650. And government regulation on how much sugar can be in a meal or drink, and those items should be taxed if they exceed that sugar amount. More prevention, make healthy food options cheaper by government tax breaks to companies that are making healthy food options. Offices should have workout rooms with locker rooms available at the company for their employees during lunch. And tax breaks on gym memberships should be available to encourage people to work out. Prevention at school. No unhealthy food options should be available for children at school, including sugary drinks should not be sold, nor should candy. Also, no meal should exceed 600 calories for lunch at school. Also, having 1 hour of physical activity in school per day should be required for each grade level. A concept map. Consuming too many calories or sugary drinks leading to poor nutrition, which is leading to diabetes mellitus, which can lead to nephropathy, leading to chronic kidney disease, then needing dialysis, and then possibly early death. Another concept map, lack of physical activity leading to being overweight, leading to diabetes mellitus, leading to retinopathy, and possibly vision loss. Another concept map, poor nutrition leading to diabetes mellitus, leading to peripheral neuropathy, leading to permanent nerve damage. And lastly, the last concept map is child with polyuria, which is urinating too frequently, leading to a diagnosis of diabetes mellitus, which is leading to a glucose level greater than 450, leading to diabetic ketoacidosis, which would lead to a patient being admitted into the ICU and being given normal saline, insulin, and potassium, and regulating their, monitoring their metabolic acidosis. And this is my reference, and thank you for your time.